Hello, my name is Inbal Drucker, and I am sport dietitian who works at sports club throughout Israel. Therefore, I'm familiar with the scenarios related to athletes and gym goers who use dietary supplements. The prevalence of this phenomena led me to try to identify and assess views among physically active adult gym members in Israel who use dietary supplements. I want to thank to my wonderful mentor, Anat Gesser Adelsburg, PhD is Associate Professor, the head of Health Promotion Program, School of Public Health at the University of Haifa. Together, we published our article identifying and assessing views among physically active adults gym members in Israel on dietary supplements in the Journal of the International Society of Sport Nutrition in 2017. What are dietary supplements? Dietary supplements come in many forms, such as powders, soft gel, liquids, and bars. They can include ingredients such as carbohydrates, protein, and various vitamins and minerals. It is interesting to note that the prevalence of using dietary supplements has increased over the last 30 years among adults in the United States. In fact, approximately half of the adults population in the United States report using one or more dietary supplements on a regular basis. In Riyadh, Saudi Arabia in 2015, the prevalence of dietary supplements used among gym members was 40%, while in gyms in Lebanon, 38% of the study participants said they take supplements. In Israel, according to data published in Israeli National Health and Nutrition Survey from the years 1999 to 2001, 21% of the people who were sampled reported taking nutrition supplements. So, as you can see, the prevalence is high, and it is even higher among athletes under 20 years of age. Why? Why do people take supplements? Many gym goers who are eager to add muscle bulk use dietary supplements to maintain a low fat, thin body for both athletic and aesthetic purposes. This is called body capital. And other reasons for taking dietary supplements include a combination of social and psychological factors. The consumers who take these supplements have the necessary knowledge and financial conditions to purchase them. In addition, the media is also an influence. For example, viewing this photo may convince certain consumers to buy dietary supplements. According to the literature, individual who takes these supplements wants to maintain health and prevent nutritional deficit, increase their energy levels, speed up recovery after physical activity, and boost their immune system. Although supplements may help consumers achieve the aim mentioned in the previous slide, several studies indicate that some supplements have been found to have side effects. One such example is caffeine, which has been known to cause anxiety, sleep disorders, cardiovascular problems such as high blood pressure, and more. Another supplement, beta-alanine, which buffers the blood, can cause paresthesia, while melamine, which is a source of nitrogen from a non-protein source, may cause kidney stones. The most common problem, however, is the presence of allergens in dietary supplements products. Additionally, there is concerns about microbiological infections or infection caused by stimulating hormones. Where is the regulatory control in this story? In the United States, the FDA attempts to regulate dietary supplements, but there is a loophole in the control process. Although manufacturers are required to register their supplements through the FDA, they are not required to receive approval before producing or selling the products. In addition, manufacturers are not required to test ingredients or new supplements in a clinical trial. The Dietary Supplements Health and Education Act of 1994 allows the FDA to stop a company from manufacturing a particular dietary supplement only after the FDA proves that it caused damage. Another problem related to the fact that there is no need for a prescription in order to purchase dietary supplements. As a result, there is no supervision or control system through which one can report negative reaction and side effects. Due to the current regulations, many products that have never been tested are sold over the counter. The question is why there is a gap between experts and the target audience risk perception and awareness when it comes to taking dietary supplements. According to Sandman's risk communication model, risk perception integrates the hazard level, it means the estimation, and the outrage level, it means the emotion the risk stimulates. If the hazard level and the outrage level are similar between the experts and the target audience, the risk may be communicated very effectively. Yet, if they are different, this can lead to controversy. In order to communicate the risk successfully, one should consider the public's feeling about the risk and make efforts to minimize the gap between the estimation of the risk among the experts and the public's risk perception. So, what is in the final analysis is my research contribution. The literature discussed the prevalence of sports dietary supplements used among athletes, but rarely discusses or compares the differing risk perceptions and attitudes existing among gym members, trainers, and dietitians who represents the physically active general public regarding sport dietary supplements. Therefore, the purpose of our study is to identify the approaches and perspectives of the public who works out in gyms and takes dietary supplements. With this aim in mind, we conduct constructive qualitative research using semi-structured one-on-one interviews. We conduct in-depth interviews with a heterogeneous population of adult gym members who takes dietary supplements and with dietitians and fitness trainers. This table illustrates the semi-structured 45 minutes in-depth interviews protocol. I will now present the main themes risk perception and communication, the source of information and its reliability, the authority status in the gym member's point of view. The main results were as follows. Are you with me? So, when gym members were asked, do you know of any side effects? The most common answer was, I don't know. When trainers were asked about side effects, some of the responses were positive, but most were unaware of the possibility of risk due to side effects. In fact, many claimed that risk only exists after excessive consumption. When trainers did address benefits versus risk, they pointed out that as long as one takes the recommended dosage, taking dietary supplements poses no risk. When trainers were asked, do you talk about side effects with the gym members? Trainers who were interviewed said they do not warn gym members about side effects. On the other hand, the dietitian reported that they do warn their clients about some of the side effects and health risks. Gym members were asked who influenced them to take dietary supplements, a trainer, a dietitian, or a doctor. Interestingly, although interviewees said that their dietitian, physician, and even trainer had some influence, they also relied on the internet and on friends. I believe the study findings facilitate a better understanding of why dietary supplements use is so widespread. In addition, the findings show that there are gaps in understanding about the risk related to taking dietary supplements among trainers, dietitians, and gym members. Therefore, we recommend that professional physician and dietitian will be present in sports clubs that sell such products in over-the-counter. We further recommend that future studies will add the perspective of additional population who work out. Most consumers in the current study lacked knowledge about supplement side effects, and further research should ascertain whether risk communication might affect a participant risk awareness. This study also indicates that information about supplements is often gleaned from the internet and friends. Thus, future studies should research the distribution of information on the internet. I would like to thank to the anonymous reviewers. Special thanks also go to my mentor, Professor Anat Gesser Adelsburg. Finally, I would like to express my gratitude to the School of Public Health, Faculty of Social Welfare and Health Science at the University of Haifa. And thank you for your time.